Welcome to This Explainer. Today, we're diving into something truly fascinating, the body's magnificent, totally invisible engine, the endocrine system. Now, you obviously can't physically see it, but this vast, complex network of glands is working tirelessly behind the scenes right this very second. It's regulating almost every single function that makes you, well, you. From your heartbeat to your energy levels, it is an absolute masterclass in biological harmony. But, as we'll see, when that harmony gets disrupted, the chaos that follows can be incredibly profound. So, let's break it all down.
Okay, let's dive right into our structured roadmap for today. We'll go from anatomical harmony to medical chaos, and then talk about restoring balance. We'll hit 1. Meet the endocrine system. 2. Common endocrine diseases. 3. Symptoms and medical emergencies. 4. Diagnosing hormonal imbalances. 5. Treatments and physiotherapy. And finally, 6. Protecting your hormonal health.
All right, starting off with Part 1, Meet the Endocrine System. So, before we can really understand what goes wrong in the body, we have to establish that baseline of harmony first. In a perfectly healthy human body, this vast network of isolated glands communicates flawlessly. And the core operators running this entire system? Hormones. You can think of them as your body's chemical messengers. They release directly into your bloodstream and travel to target organs to control absolutely critical daily functions. We're talking about your growth, your metabolism, your blood sugar, how you respond to stress, your reproductive system, and yeah, even your sleep cycles. These messengers are basically the invisible forces dictating your daily energy, your core body temperature, and your overall mood.
Let's move on and see how this actually builds up into a cohesive network. You've got some major players at work here. Notice the pituitary gland right at the top. It's basically the CEO or the master gland of the whole operation. It pumps out hormones that regulate a lot of the other glands further down the chain. Then you have the thyroid, which dictates your metabolism and energy production. And of course, the pancreas. That's your body's dedicated blood sugar regulator, producing insulin and glucagon. When all these glands, along with your adrenals and reproductive glands, work together perfectly, your body is in total equilibrium.
Let's shift gears to Part 2, Common Endocrine Diseases. So what happens when that beautiful equilibrium just breaks? Well, we shift pretty quickly from wondrous anatomy to systemic chaos. This chaos is exactly what happens when hormone production is way too high, when it's dangerously low, or when the signals are just completely ignored by our body's target cells. The most common battlefield we see here is blood sugar, which brings us to the diabetes mellitus spectrum. You've got type 1, type 2, and gestational diabetes. The immediate symptoms are classic red flags, right? Increased thirst, frequent urination, unexplained weight loss, and just massive crushing fatigue. But if left unchecked, the heavy toll of diabetes leads to severe systemic complications. We're talking neuropathy, retinopathy, which can literally lead to blindness, kidney disease, and cardiovascular issues like stroke. It is a really stark reminder of how one single hormonal malfunction can impact the entire body.
And this brilliantly illustrates what happens when the thyroid malfunctions. It essentially pushes the body to extreme ends of a spectrum. On one side, we have hypothyroidism. This is where there's reduced hormone production, so the whole system just slows down. You'll see things like weight gain, cold intolerance, dry skin, and really deep fatigue. But then contrast that with hyperthyroidism on the flip side. That's excess hormone production, where the system shifts into extreme overdrive. We're talking rapid heartbeat, weight loss, heat intolerance, tremors, and severe anxiety. It's an incredible visual of the two extreme ends of the thyroid disease spectrum.
But it doesn't stop at the pancreas and the thyroid. There are other profound systemic disruptions out there. Take Cushing syndrome, for example, which is driven by excess cortisol production and leads to central obesity and muscle weakness. Then there's Addison's disease. This is where severe adrenal insufficiency causes extreme fatigue and dangerously low blood pressure. We also see things like polycystic ovary syndrome, or PCOS, causing irregular periods and weight gain, and acromegaly, which is an excess of growth hormone in adults leading to enlarged physical features. The root causes of all these life-altering physical and emotional changes, they typically stem from autoimmune issues, tumors, or just pure genetics.
Moving into Part 3, Symptoms and Medical Emergencies. Because these systems are so incredibly vital to our survival, disruptions can escalate extremely fast. Listen, we aren't just talking about having an off day here. These are life-threatening medical emergencies that require immediate hospital action. The absolute climax of endocrine chaos looks like diabetic ketoacidosis, or DKA, a hyperosmolar hyperglycemic state, a thyroid storm, myxedema coma, an Addisonian crisis, or severe hypoglycemia. These are critical full-system failures. Recognizing these extreme red flags is literally the absolute difference between life and death. If the endocrine system crashes into a coma or an adrenal crisis, rapid emergency medical intervention is absolutely the only way back.
Okay, let's pivot to part 4, diagnosing hormonal imbalances.
Fortunately, modern medicine is incredibly well equipped to step in before or during these crises. Healthcare professionals basically act as clinical detectives to investigate and solve the chaos happening inside the body. And this investigation follows a really logical, step-by-step clinical progression. Step 1 always starts with a thorough medical history and physical exam to spot the external physical clues. Once a doctor suspects an issue, they move right to Step 2, blood and urine tests, looking deep into the bloodstream to catch chemical imbalances. Finally, if they need to see exactly what's happening structurally, they progress to Step 3, rolling out advanced imaging like ultrasounds, CT scans, or MRIs.
Now, what's remarkably interesting here is just how pinpoint precise these diagnostic tools have become. Blood tests check highly specific hormone levels, like HbA1c for long-term blood sugar trends, TSH for your thyroid, and cortisol and ACTH for adrenal function. But the imaging? That's where the real detective work pays off. Thyroid ultrasounds, pituitary MRIs, and nuclear medicine scans can pinpoint the exact anatomical source of the malfunction. I mean, they can spot a tiny, benign nodule on a specific gland, which allows doctors to target the root problem directly. It's like finding a needle in a haystack, but with lasers.
Let's look at the solutions in Part 5, treatments and physiotherapy. So once the problem is actually found, the work to fix it begins. Medicine today uses a fantastic multidisciplinary toolkit to systematically fix the issue and get the patient back to their baseline health. The primary interventions are highly systemic. If a gland isn't producing enough of a hormone, well, the medical goal is hormone replacement therapy, like taking insulin for diabetes or levothyroxine for hypothyroidism. Conversely, if a gland is totally overactive, doctors will use hormone-suppressing medications, and in cases where there are tumors or severe overactivity, surgery or radiation might be the best route. Procedures like a thyroidectomy or an adrenalectomy physically remove the problematic tissue to stop the hormonal flood entirely.
But fixing the chemical balance? That's really only half the battle. Physical rehabilitation is incredibly vital. Endocrine diseases severely impact muscle weakness, bone pain, and overall energy levels. That's why physiotherapy, through targeted aerobic exercise, resistance training, and balance training, is absolutely essential for physically rehabilitating endocrine patients. It builds back muscle strength, increases endurance, reduces that crushing fatigue we talked about, and critically, it helps prevent falls, which is a huge deal for patients dealing with osteoporosis or neuropathy. It's all about restoring functional, everyday mobility.
Finally, Part 6, protecting your hormonal health.
Now, it's time to loop all this clinical data right back to you. We want to empower you with the everyday, actionable lifestyle choices you can make to protect yourself. So, the crucial point is that proactive lifestyle modifications actively protect our delicate endocrine balance. Maintaining a healthy diet, managing your weight, getting regular exercise, prioritizing adequate sleep, and reducing stress, these aren't just generic health cliches. They directly influence things like your insulin sensitivity, your cortisol levels, and your thyroid function. Coupling these everyday habits with regular health checkups gives you a massive advantage in preventing complications way before they even start.
Now, a question we hear all the time when discussing this topic: can endocrine diseases actually be cured? Well, the honest clinical answer is that while a few conditions can be completely resolved with surgery, most endocrine disorders do require lifelong follow-up and sticking to your medication. However, and this is a big however, outcomes improve massively with early intervention. Catching it early deeply reduces complications, meaning you can regain complete control over your well-being.
Which brings us to this really powerful final thought. Early diagnosis, proper medical treatment, healthy lifestyle choices, and physiotherapy can help people live healthy, active, and fulfilling lives. Having an endocrine disorder definitely does not mean your life stops. It is entirely about fully living with the condition rather than just surviving it. Your endocrine system is the invisible architect of your entire life experience. So the next time you feel a sudden rush of energy or an unexplained wave of fatigue, ask yourself, Which of your chemical messengers is trying to tell you a story?